Well, hello and welcome to this live virtual forum, folks. We've just got a few folks on right now. We're dialing out to thousands of your fellow constituents in the 33rd Congressional District of Texas. We appreciate you joining us today for this live virtual forum with your Congressman, Mark Veasey. He will be on the line with us in a moment here to provide us some updates, and then we'll spend most of this event today on live Q&A. So again, welcome and thank you for joining us. For those of you just joining, we are dialing out to over 42,000 of your fellow constituents in the 33rd Congressional District of Texas right now for this live virtual forum. We'll be joined in a moment here by your Congressman, Mark Veasey. He's here to provide some updates and discuss seniors issues for constituents on the line with us. So thank you again for joining and welcome. If you already have a question in mind for Q&A, press 0. Give that question to an operator, and they'll take some notes. We'll be taking questions for the majority of this forum after some brief updates. So again, 0 to submit a question for Q&A. We're here to focus on seniors issues today, so you may have questions on things like Medicare, Social Security, reining in prescription prices, any other issues that are important to you here in the 33rd Congressional District of Texas. We want to take them on today. So again, we'll hear from your Congressman, Mark Veasey. He'll have some updates. Once we hear those important updates, we will go to questions from you folks in the live listening audience. So as you listen in, think about questions you'd like to submit for Q&A. And then again, as soon as you have a question you want to submit for Q&A, press 0. Give your question to an operator. They'll take down some notes and put you in the line to ask your question live in the forum. But if that's not comfortable for you, you can also let your operator know that you want me to read your question over the air instead. So you can submit a question by pressing 0. If you prefer to have me read your question instead of bringing you live, just let your operator know that, and I'm happy to read it for you instead. Of course, we'd be happy to hear from you as well, so if you'd like to go live with your question, again, 0 to submit a question either way. You can also register to get email updates from Congressman Veasey on the issues that affect you moving forward. You can do that by pressing 7 on your phone. Again, 7 to give us your email address to get email updates from Congressman Veasey. Again, we're just about to get started with our live virtual forum. I'll repeat these brief introductory comments again one more time, and then we'll go ahead and get started. This is a live telephone town hall meeting with the 33rd Congressional District of Texas. Tonight we're joined by your Congressman, Mark Veasey, who is here to provide you with updates on what's happening in Washington, D.C. We'll hear from him shortly. He'll also provide you on updates on issues like Medicare, Social Security, reining in prescription prices, and other issues that are important to our seniors in the 33rd Congressional District of Texas. Once we hear those important updates, we will go to questions from you folks in the live listening audience. So, as you're listening in, you can submit a question by pressing 0 on your phone to give it to an operator. They'll take down some notes, put you in line to ask your question live, but if it's not comfortable for you to ask your question live, still press 0. Still give that question to an operator, then just let them know that you'd like me to read your question if that's more comfortable for you. And again, you can also press 7 tonight to register for email updates from Congressman Veasey. We'll also get you some more information on how to contact Congressman Veasey in just a moment here, so grab a pen and paper if you need any constituent contact information for his office. We'll get to that in a moment. We'll also have some survey questions. You can vote in those using your phone, but let's go ahead and kick off our live forum now. Again, welcome, folks, to this live forum. It's my pleasure to kick off our live telephone town hall meeting by turning it over to your Congressman, Mark Veasey. Please go ahead, Representative.
To everyone in the 33rd Congressional District. This is Mark Veasey, your Congressman, and I hope that everyone out there had a very restful and enjoyable Memorial Day weekend. I am excited to welcome everyone here to the Senior Citizens Telephone Town Hall today. And during this town hall, I'm going to discuss a lot of topics I think are important to the North Texas community, like Medicare and access to Social Security, and what we're doing to curb rising prescription drug costs. And we will also be giving the audience a chance to ask me questions about my work in Congress and what my colleagues and I are doing to help seniors in every corner of our nation. Before we start focusing on topics that impact senior citizens, I want to offer my condolences to the citizens of Uvalde, Texas, as they start laying to rest those who passed and died in last week's horrific shooting. Mass shootings like the one that occurred in Uvalde cannot keep happening in our nation. I hope that we will use this tragedy and the mass shooting in Buffalo that occurred a few weeks ago to finally take common sense action to stop criminals from getting guns. As your member of Congress, I remain committed to doing this by passing common sense measures like background checks and enacting red flag laws that will help prevent future tragedies from happening. And with that, I want to pivot to what we have been doing to help our senior citizens, because I know that a lot of you that are on the call today, that's why that you have called in today to talk about senior citizens, and especially the rising cost of prescription drugs that so many older Americans depend on. And since I began serving this district in Congress, I've fought to lower drug prices by advocating for Medicare to negotiate the price of prescription drugs. I proudly serve on the Energy and Commerce Committee that focuses on pressing issues like health care, like prescription drug costs, and I have voted for multiple pieces of legislation that will allow Medicare the authority to do so, and will make sure will make sure that we enact lasting measures that lower prices and ease access to affordable medicine all around, because we really do need to lower the cost now. As I go out and about in the district in different places in Fort Worth and in Dallas and Irving and Forest Hill and Cockrell Hill, no matter where I go, this is definitely something that people ask me about. The beginning of this year also marked a very important milestone for Social Security. January the 31st marked the 82nd anniversary of the first Social Security check being sent out. So think about that, the 82nd anniversary of the very first Social Security check being sent out. Social Security provides a vital lifeline for many Texans in the 33rd District. In fact, over 83,000 of the constituents that I represent rely on Social Security. That is why I'm committed to working with my colleagues to ensure there are no vital cuts to this important program that ensures dignity and financial security for Americans as they age, especially as we continue to get to the other side of the COVID-19 pandemic. That has only underscored just how important Social Security is to our country. And I want everyone to know that I remain committed to ensuring all Americans, no matter what age, access not only affordable prescription drugs, but comprehensive and safe health care, because people really should not have to pick between a life-saving procedure or putting groceries on the table, which is why I remain committed to bolstering and expanding programs like Medicaid and Medicare so that many more Americans that really need them can rely on them being there. And before we turn it over to questions, I want to make sure that everyone on this call know that the office is here to help. We help constituents all the time if they're having trouble with Social Security, if they're having trouble with Medicare, Medicaid. We can give you resources where you can get help just in case someone's trying to scam you and asking you questions about your Medicaid or Medicare and you're suspicious about it. And we want to be especially on all of these federal issues, we want to be a resource for you. And so if you have a question, you can always call either the Dallas office at 214-741-1387 or the Fort Worth office at 817-920-9086. And with that, I'm going to hand it back over to the moderator to open it up for questions.
Thank you again, Congressman, and appreciate you all being with us here today. A reminder, if you have a question for Q&A, you can submit that by pressing 0 on your phone, giving that question to one of our operators. We are going to go ahead and start with our live virtual forum now. So for those of you who are on the line, if you have a question to submit for Q&A, you can press 0 to give that question to an operator. You can either go live with your question or you can let your operator know that you want me to read your question over the air instead. Again, 0 either way if you want to submit a question for Q&A. And then if you'd like to get email updates from the Congressman's office, press 7 on your phone. We've got our first question coming to us from Melissa here, who's asking, should the government take a more active role in passing laws that will curb gun violence? Congressman, can you take this question on for Melissa, please?
Yeah, absolutely. Melissa, thank you for your question. I absolutely think that Congress should play an active role in making sure that criminals and terrorists and people that are mentally unstable and other dangerous people should not get guns. Those type of people should never have guns, and it's really unfortunate that even for people that are on no-fly list, that aren't allowed to get on planes, that I cannot get my Republican colleagues to join with me and other Democrats to just pass common sense background checks that would make it hard for people to get guns like we've seen in some of these incidents and some very horrific mass shootings. We have absolutely got to do better, and we need for Republicans to join with us on passing these common sense measures that 90% of the American public supports. So thank you very much for your question. We absolutely play a role, need to play a larger role in trying to stop bad people from getting guns.
Thank you so much. Appreciate that, Congressman. And we are going to run our first poll question in a moment here. Let's get one more question in first, and then we'll go ahead and jump to that first polling question. Let's go to a question we've got from Joanne in Arlington first, though. Joanne in Arlington, you are live on the line. Go ahead with your question for Congressman Veasey.
Yes, I want to ask, are we going to get stimulus checks?
Right now, I don't believe that we have any more stimulus checks. You know, we passed the CARES Act, and we passed other measures to give people stimulus checks during COVID-19. But I don't believe that we have anything else in the works right now to pass another round of stimulus checks. Now, if we go back into a COVID-19 posture, you know, perhaps we will have to you know, do that again. But right as of right now, there are no plans that I am aware of that will give us any sort of new stimulus checks.
Got it. Thank you, Congressman. Thank you, Joanne. We're going to go to Juana's question from our Spanish simulcast broadcast in just a moment here. But first, let's run our first survey question. We want to know, what is the most important issue that you think Congress and the Biden-Harris administration should prioritize? Press 1 if you think it's protecting Social Security. Press 2 if you think it's lowering prescription drug costs. Press 3 if you think it's fighting against the COVID-19 pandemic. Press 4 if you think it's passing common sense gun safety measures. And press 5 if it's bolstering access to Medicare. So again, what is the most important issue that you think Congress and the Biden-Harris administration should prioritize? Press 1 if it's protecting Social Security. Press 2 if it's lowering prescription drug costs. Press 3 if it's fighting against the COVID-19 pandemic. Press 4 if it's passing common sense gun safety measures. Press 5 if it's bolstering access to Medicare. Thanks for voting on that poll. We'll go to our next question right away. This one's going to come to us from our Spanish simulcast broadcast from Juana in Dallas, who's asking, if I only have Medicaid, can I get additional medical assistance? I need someone to bring my medicine to my home. Thanks for reaching out. Juana in Dallas. Congressman, can you take on this question from her, please?
I'm sorry, would you read the first part of her question again?
Of course. Yeah, she says, if I only have Medicaid, can I get additional medical assistance?
If you only have Medicaid, can you get additional medical assistance? That is a good question. There may be other programs out there that you may be able to receive help on. What I will do is ask you to reach out to my office and speak with one of the caseworkers, either in the Dallas office or the Fort Worth office, to see if they know of any additional programs that are out there that help people that are on Medicaid. There certainly may be some prescription drug discount plans or some other programs out there that will help people that qualify for Medicaid that need that additional help, because we know that even though Medicaid can be a tremendous lifeline for families, that sometimes it's not enough, and we certainly want to make sure that people that fall into that category can get that additional help if they need it.
Perfect. Thank you again, and I appreciate you, Juana, and our Spanish simulcast broadcast for submitting that question. A reminder, if you have a question to submit for Q&A, you can press 0. You can either ask your question live, or you can let your operator know that you want me to read your question over the air. We're focusing on seniors issues today, so we'd love to take as many questions as we can on that, but we'll take on topics, all sorts of topics today. So again, 0 to submit a question for Q&A here. Next one's coming from Linda in Rolling Hills. Linda, thank you for waiting. Go ahead. You're live.
Yes. My question is, why is it so hard for the elderly to receive food stamps?
Thank you, Linda.
Yeah, no, that is a really good question. Depending on one's income level, they may or may not be able to qualify for food stamps, Linda. The program, or now it's just more commonly known, SNAP, was created to help people that are in a lower income bracket, or people that are having that have children in particular that are in a lower income bracket, be able to get that extra food supplement that they need. If anyone thinks that they do qualify for SNAP and that they've been wrongly denied SNAP, they should definitely call one of my offices. And I didn't say this with Juana earlier, but people speak Spanish in both of our district offices, and so we certainly want people that speak Spanish to reach out to those offices if they need those services, whether it's this or Medicaid. But it certainly could be a eligibility issue, Linda, and that's probably what it is. But if you feel like that you were wrongfully denied, or if you know someone that was wrongfully denied, please have them call our offices. And for seniors that are sick and shut in, remember there are other services that may be available too for seniors that just can't get out and about. We have Meals on Wheels that bring hot lunch out to senior citizens. We have a variety of different food banks. North Texas Area Food Bank does a great job of getting food out to seniors and help people supplement their income in those ways. And several of the churches have food banks. And so if people are having a hard time, please reach out to our offices so we can connect you to some of those other resources in the community where you can go and get that food supplement to help out a little bit. And I know that it's really especially hard on grandparents right now in the 33rd Congressional District. We have a lot of grandparents out there, not just a few, not just 5%, not just 10%, but we have quite a few grandparents out there that are actually raising their grandkids, and they may not qualify for SNAP. And so we want those grandparents that are raising their grandchildren to know about these other resources that are available too. But if you think that you have been, again, wrongfully denied, please reach out to the Dallas office or the Fort Worth office. And yes, we do have caseworkers in both offices that speak Espanol.
Thank you so much. Appreciate that answer. And thank you again to Linda in Rolling Hills for our last question. A reminder, you can press 7 if you'd like to get email updates from Congressman Veasey. Let's go to our next question right away from Milton in the north side of Fort Worth. Milton, thanks for joining. You're live with Congressman Veasey. Go ahead.
Hi, Congressman. This is, of course, you know my name. I am 73 years old, Vietnam veteran, and I currently have a little bit of disability, but I've been trying to get the VA to make a decision on the bigger one for about 3 years now. And I talked to those guys, and the counselor here from Tarrant County, and they tell me, oh, it might be another 3 years. So I'm thinking the strategy is just wait for me to die, and they don't have to worry with me anymore. But it seems like they take care of the younger vets, and they process their claims very quickly. But all I'm asking for is a yes or no. And I think 3 years is long enough to wait. I was wondering if your office might help me on that.
Yeah, no, Milton, you're absolutely right. 3 years is long enough to wait, and I know that it can be frustrating. I'll share a story with you. Before I worked in Congress, and previous to my work in the Texas legislature as a state representative, I was a congressional staffer and worked for Martin Frost, who was a congressman here in Tarrant County and Dallas County for a number of years. And there was a case that was still active when I became the congressman in the 33rd district, that the caseworker that was heading it up in Martin's office that now works for me, she was still working on that case, and you're talking about, close to 20 years later. So we know that the backlog, that getting these cases expedited for a lot of our veterans is a real issue. And please reach out to my office if you have not already. Please reach out to see if we can help expedite that matter. We don't guarantee that all of the answers that you get back from the VA are going to be favorable, but we do our best to get a favorable response for constituents. And more importantly, we do our very best to get an answer for constituents in a more timely manner. And so please reach out to the office. It's a very easy process. If you call since you're on the north side of Fort Worth, you should call the Fort Worth office. It's a very simple process that involves you doing a privacy release form, so we can advocate on your behalf. So we have permission from you to advocate on your behalf. And so please reach out to my Fort Worth office and try to see if there's something that we can do to help speed it up.
Thank you so much. Appreciate that, Congressman, and thank you for reaching out with that last question. Milton, the Congressman's office is saying they're telling me they've got your contact information and they are going to follow up with you, so you can expect the Congressman's office to reach out, Milton, and provide some assistance if you haven't reached out to them already. And we'll go to our next question. This one comes to us from Brian in South Lake, who's asking, what is Congress doing to help Texas senior citizens? Congress, can you take this one on for Brian in South Lake?
Yeah, absolutely. There are a lot of things that we're trying to do to help senior citizens. I talked a little bit earlier about allowing Medicare to negotiate drug prices to help lower those drug prices for a lot of our senior citizens and the senior community that's out there. Another thing that we are talking about doing is the Veasey Larson Social Security proposal that strengthens benefits and builds on what works. This Social Security 2100 Act increases benefits across the board for everyone that's on Social Security, improves the COLA, also known as the cost of living adjustment, so it reflects the inflation actually experienced by seniors. Make sure that no one retires into poverty after a full career of work by improving benefits for long-serving, low-wage workers, improves benefits for widows and widowers from two-income households. A lot of you on this call know that has been a big, big problem for people that are from two-income households, and increases access to benefits for children living with grandparents, something that I talked about earlier. It also repeals the windfall elimination provision and the government pension offset that currently penalizes many public servants. I know in particular that our teachers ask about that all the time, and ends the 5-month waiting period to receive disability benefits. People need that money immediately, and making them wait 5 months is not good. So, we need to absolutely fix that, and we need to we need to help our senior citizens by working on that.
Thank you again, Congressman. Very much appreciate that answer. Thanks for our last one came from Brian, and we're going to go next to Kathy. Thanks again, everybody, for joining us. We've got about a half hour left in this live forum. We'll take questions right up until the end. So, again, 0 per question, 7 to get email updates. Kathy, thank you so much for waiting. You are live on the line with Congressman Veasey. Go ahead.
Good morning. I hope everyone's having a good day. The question I have is, does Congress have any plans to address the increased prices of fuel and food? And for those of us who have children and grandchildren that live out of state, we're unable to afford to buy the gas to go visit them. So does Congress have any plans to address these issues?
Yeah, no, that is a very good question. I know that fuel costs in particular continue to be something that a lot of Americans have been asking about. Right now, there are certain provisions that are being looked at, like, for instance, eliminating or temporarily suspending the gas tax. I know that is something that people have looked at to be able to help. But honestly, long term, right now with everything that we had during COVID, the war that's happening right now in Russia, there doesn't seem to be anything that can immediately help bring down prices. There just doesn't seem to be anything that can immediately help bring down prices. And so I understand that it is very painful for a lot of people to pay what they're paying right now, and trying to do something about the high gas prices without the country going into a recession is very difficult at this moment. I do think that there are some things that can be done that would help. One of the things that we can do to bring more oil and gas to the market is if we were to pass comprehensive immigration reform. We need additional workers to work in the oil patch to be able to maximize output here in Texas. And because of efforts by Republicans in particular to stop us from having immigration reform and stopping us from passing immigration reform out in the Permian Basin here in Texas, they just have a shortage of workers, and so they can't bring as much oil to market as they normally would be able to because we don't have immigration reform. If you go out to the oil patch right now in the Permian Basin, most of the individuals that work there in the Permian Basin and in the South Texas formation are mostly Latino workers, Hispanic workers, and the Republicans keep blocking us from bringing more of this oil to the market that will help bring down the prices. And so, so please reach out to our two Republican U.S. senators and tell them we need to pass immigration reform because it would help bring down oil and gas prices in this country and help bring down gasoline prices.
Thanks again, Representative. Thank you to Kathy in Arlington for our last question there. We're going to go right to Corrine in Fort Worth here next. Corrine, thanks for waiting. You're live with Congressman Veasey.
Hi, I bring in $351 a month for Social Security, and that's it until I'm 65, which is 2 more years away. But there's nothing out here I can rent. My place right now is $1,100 a month, and I just got an eviction notice. What is out there to help? I know there's those 30-70 places, but there's waiting lists forever on them.
Yeah, have you gone to apply for Any help at Fort Worth Housing Authority so you can get some Section 8 voucher?
They say the housing's closed.
Okay, well, let us look into that for you. Give my office a call. Are you calling from Fort Worth or Dallas?
Fort Worth.
Please call the Fort Worth office so we can look into that to find out what's going on. We know that rental prices in the Dallas-Fort Worth area are soaring through the roof right now. We saw a huge uptick in prices after COVID-19 and just the sheer number of people that are moving here too, right? Like we have hundreds of people a day that are moving to the Dallas-Fort Worth Metroplex from other parts of the country. And so we know that that is also putting a lot of upward pressure on rents as well. So please reach out. We do know that this is a huge problem for a lot of our low income, a lot of our senior citizens and people that are on fixed incomes. And so we definitely want you to get the help that you need and deserve. And so please call the office to reach out to see what other options may be available for you. But I do understand that it is a serious problem. It's something that people discuss with me on a pretty frequent basis.
Yeah, thank you so much, Congressman, and appreciate the help of your office as well. And Corrine, we've got your contact information, and the Congressman's office will reach out to you. But if anybody out there does need assistance from the Congressman's office, that Fort Worth office phone number, one more time, is 817-920-9086. Again, that Fort Worth office phone, 817-920-9086. But Corrine, the Congressman's office will be reaching out to you, so thanks so much for being with us today and for your question. We're going to go to, we've got a question here I'll be reading from Victoria in Arlington, then we've got Deborah in Fort Worth in line after that. This one comes from Victoria. She's asked me to read it. She says, my friends and I really struggle to afford our prescriptions. What are you doing to reduce those costs? That one's from Victoria, Congressman.
Yeah, absolutely, Victoria. I'm glad that you asked about that again, because I really don't think that we can talk about it enough, and that is obviously prescription drug prices. I talked earlier today about the fact that I have been a proponent of Medicare being able to negotiate lower prescription drug prices for that plan. We know that it's a big problem. I know that people talk with me all the time about the fact that prescription drugs are too expensive, and we need to be able to bring the prices down. It's actually been something that has been an issue for a long time. I can remember back in the 90s when I was a congressional staffer, and Democrats conducted an investigation back then that found that the 10 most frequent drugs used by senior citizens were also the most expensive drugs on the market on a day-by-day, average daily basis, that they were actually charging senior citizens more for these drugs because they knew that senior citizens had to have those drugs, and they didn't have any choice but to take them if they wanted to be able to maintain their health. And so we found out that the pharmaceutical companies were actually gouging prescription drugs. And so we need to make sure that we can do things to help our senior citizens, like making sure that we close the Medicare Part D donut hole. This coverage gap opened up after the initial plan had actually been passed, and so we need to continue to look for ways to make sure that everyone is in and covered in that coverage gap, to make sure that they're not having to cover any excess costs based on their Medicare. We know that this is a huge problem. It just continues to be an issue. I also think that we need a lot of transparency with prescription drugs. There's a lot that happens with the manufacturing of prescription drugs before the drug actually makes it to your pharmaceutical counter. and a lot of the public never sees the negotiations and how those prices impact you as those drugs are passing through different hands as they make their way from the manufacturer to your pharmacy counter. And just bring in, I think, some transparency in the entire process would go a long way in being able to help. And so we need to make sure that there are no more coverage gaps. We need to bring the prices down, and we need more transparency in the way the process works. And we need for Medicare to be able to negotiate to help bring down these prices for Americans, because we know that there are a lot of people that are having to cut back in other areas that are also very vital to their existence and to their families because they need these prescription drugs, and it's unjust. Thank you very much for your question.
Yeah, appreciate you again, Congressman. Just to give a preview of who we've got coming up next, we're going to talk to Deborah next here from Fort Worth. We've got Sarah in Southlake, Janice in Cockrell Hill, and Pat in Dallas. Thanks again, everybody. Pearl in Fort Worth after that. So thank you, everybody, again for submitting these questions. One more reminder, you can press 7 to get email updates from Congressman's office. Let's go to Deborah in Fort Worth live next. Deborah, thank you so much for joining us. What's your question for Congressman Veasey?
Well, hi, Mark. How are you doing? I'm a senior citizen. Thank God I turned 67 yesterday, and I retired yesterday. So this is the first day of retirement for me. And my problem is property. Oh, well, thank you. Property taxes. I had to pay like $3,000 more property taxes, and my house note went up extra a little over $200 and something dollars. And being a senior citizen now on a fixed income, you know, you don't have no extra coming in where a job you can get some overtime or whatever. Is there anything they do to stabilize your taxes? It's unaffordable because people are building houses and maybe they're going up, but when I bought the house, it wasn't up. So what is it to help a senior citizen that's going to be on a fixed income? I may not have $3,000 to give them next year.
Right, exactly. Yeah, that is a big problem. And I know that the property tax part that pays for our public schools, that's something that everyone pays, and so you're not getting the senior exemption on that particular part of your taxes. Are you getting are you already, has your exemption already kicked in?
Yes,
for some of your,
okay. Yes.
Okay, good.
And homestead. Those were the two things that I did.
Right, exactly. Well, let me say this. The first thing is that the first thing that I will say is that most of the property tax issues, all of the property tax issues, to be honest with you, that's something that our state legislature is tasked to look into. And so depending on where you live in Fort Worth, please reach out to your state representative or your state senator to let them know that you would like to see some reform in that area. I know that it's a big problem. When I was in the state legislature, it was something that constituents talked with me about often. It was something that businesses talked about often, how much they were paying in property taxes. And it is a big issue. And as the state continues to grow and more people live here, it's going to continue to be an issue that the state is going to have to try and figure out. The perfect example that I like to use is Mansfield. When I was in high school 30 years ago, there was one high school in Mansfield. It was Mansfield High School. Now they have 5 or 6 high schools. That just shows you just the sheer number of people that are moving here from all around the country, and it certainly is more expensive to be able to provide a quality education for that many more students that are on the books. And obviously we need to be able to do that, but it is a very difficult task that the state legislature has to do every other year. but I urge you to reach out to them because I understand that it is a real problem.
Yeah, thank you again, Congressman, and thank you so much, Deborah, for being part of our call here. We've got the results of our last polling question. We asked what's the most important issue you think Congress and the Biden-Harris administration should prioritize. 41% of you said it was passing common sense gun safety measures. We have 39% said it was protecting Social Security, 10% to lowering prescription drug costs, and the rest split between fighting against COVID-19 pandemic and bolstering access to Medicare. Let's get to our next poll here before we get to our next question from our audience. Next question for you is this. Do you believe Congress should make passing common sense gun violence protection their top priority? Press 1 for yes and 2 for no. Again, do you believe that Congress should make passing common sense gun violence prevention their top priority? Press 1 for yes and 2 for no. Thanks again for voting in those polls. We'll have one more in just a bit here. Let's get to Sarah in South Lake as promised. Sarah, thank you so much for waiting. You are live on the line with Congressman Veasey.
Yeah, I asked my question because I wanted to emphasize that gun violence is not only a problem in schools and public places, it's also a problem for senior citizens. I'm 75, and we have had 2 problems in the assisted living area where I live. One, an individual who lives in the same area got a hold of a gun and shot himself and killed himself. That could have been prevented. Second, we have had a lockdown here when a gunman had committed a crime and was roaming the area, and our senior living facility, as well as 2 local schools, were locked down for several hours while the person was captured. Gun violence is not something that only affects schools and people on the street. It's of great interest to senior citizens. And I am a Republican, but I am very interested in the problems of gun control here in Texas and in the rest of the United States. Thank you.
Yeah, no, absolutely. And I appreciate your concern. I mean, to me, it just makes common sense. We don't let terrorists get on planes, and we have a no-fly list to try and prevent them from getting on planes. So why can't we pass a bill that stops them from getting guns? Those same people that are on the no-fly list that can't get on a plane, why can't we pass a law to stop them from getting firearms? People that are mentally unstable, there are many things that they cannot do in society. So why in the world do we let them be able to buy guns? It doesn't make any sense. I agree with you 100%. There has to be more done to help curb this gun violence. We have some very common sense proposals out there that over 90% of the public supports, but Republicans keep stopping us each and every way. And, I've talked about this on the calls before, but one of the problems with D.C. is that, some of these groups and organizations amass so much power and politicians become afraid of them. So instead of doing what's right, they become very beholden to the group. And unfortunately, the NRA is the epitome of politicians being afraid and being beholden to a group instead of doing the right thing. It's very unfortunate. It's very sad, and real leaders need to step up and not be so concerned about what's going to happen in their primaries. We need for people to get help so we can pass these gun safety bills. We need to stop bad people from getting guns. We need to get help in this country on this issue very, very badly. We can't continue to have these mass shootings and just do absolutely nothing about it. I appreciate your question.
Thank you, Congressman, and thanks for being with us today. Sarah, appreciate you sharing a personal story there. And we'll go to our next question from Janice, who's asked me to read this from Cockrell Hill. She asks, what are your thoughts about how the Biden-Harris administration's COVID-19 response and recovery efforts are making things better for us seniors? Can you take that for Janice, please, Congressman?
Yeah, absolutely, Janice. Absolutely. The Biden-Harris policies have definitely made COVID-19 and the response better for everyone. First of all, they emphasize the importance of making sure that everyone got a shot in the arm. Now, there were some people that held out and some people that didn't do it, but for the most part, compliance went up significantly after Joe Biden became president. So what that has done is that we still haven't been 100% cured from COVID-19, but as you can see, hospitalization rates have gone down significantly. People are back to work, and it's making a big difference. Again, people still need to use caution and use good judgment, but it appears that the virus has weakened significantly, and that is because the Biden-Harris administration did everything they could in their power to make sure that we got shots in the arms. I would say that the other thing that the administration did a really good job on is the response to COVID-19, making sure that our small businesses didn't fail, making sure that we got help to people so they could stay afloat in between the time that COVID started and where we are now. And I mentioned the small businesses, and why I think that's so important is that most people that work someplace in this country work for a smaller business. And had we had all those small businesses fold and go under, our economy would be in a much more dire position than it is now, because the economy is actually, if you look at people working, if you look at wages being higher than ever before, the economy is probably the best that it's been in a very, very long time. People are being given the flexibility to work from home. We haven't seen days like this as good for employees in this country in a very, very long time period. And so I give credit to the Biden-Harris administration for these measures and for these actions, and not just sitting back and waiting, but actually taking action to make sure that the economy could stay afloat during what was something that hit us, and no one knew what to do, and God forbid we ever have to do it again. But you want someone like Joe Biden in charge that's going to take it seriously and not blow it off or try to take it for granted for political purposes. We need for people to understand that when in times like this, there are sacrifices, but people have come together to do the very best that we can. And I think that Joe Biden really helped facilitate a lot of that.
Thank you again, Congressman. Thank you to Janice and Cockrell Hill for our last question. Pearl in Fort Worth, you're up next. Hang tight. We've got our next survey question coming up. First, the results of our last one, though. We asked, do you believe Congress should make passing common sense gun violence prevention their top priority? 90% of you said yes. 10% said no. On to our next poll. Our question for you is, how concerned are you about the price of prescription drugs? Press 1 if you're not at all concerned. 2 if you're slightly concerned. Press 3 if you're somewhat concerned. 4 for moderately concerned. And 5 if you're extremely concerned. So again, how concerned are you about the price of prescription drugs? Press 1 if you're not at all concerned. 2 for slightly concerned. 3 for somewhat concerned. 4 for moderately concerned. And 5 for extremely concerned. Go ahead and vote now, and while you do that, we'll get Pearl up here from Fort Worth. Pearl, thanks for waiting. You're live with Congressman Veasey.
Congressman, I would like to know what is Congress doing to oversee the nursing home and assisted living facilities. We have not seen any action or heard of anything and they at one time were in terrible shape. Would you comment on that, please?
Yeah, no, absolutely. Thank you for asking me about the nursing homes. During COVID-19 in particular, people that were in nursing homes were very susceptible to getting COVID and dying from COVID-19. That's where we saw a lot of our COVID-related deaths were at nursing homes. And so nursing homes are very important because they provide long-term care for people who don't need to be in a hospital, but they can't stay in their own home. And in the United States, a majority of nursing homes are certified by both Medicare and Medicaid. And we obviously need to make sure that we're doing everything that we can to make sure that older adults and people with disabilities that require them to be in a nursing home, that any challenges that they face in being able to get the support, that we help them out as much as possible. And so the American Rescue Plan that was passed back in 2021 included provisions of addressing a number of the issues that we commonly hear are affecting nursing homes. The Medicaid provisions in the rescue plan allocated about $200 million to the Department of Health and Human Services to carry out infection control and vaccination uptake support to Medicare certified homes, and it also appropriated about $250 million to HHS to establish and implement state teams to assist Medicare certified nursing homes with clinical care, infection control, and staffing and pandemic emergencies for the following emergency period. And in 2022, just a few months ago, President Biden announced a set of reforms developed and implemented through HHS that will improve the safety and quality of nursing homes and hold them accountable for the care they provide and make the quality of care and facility ownership more transparent. Richie Nail and Frank Pallone, and Pallone chairs the committee that I serve on Energy and Commerce. They have a Nursing Home Improvement and Accountability Act, which would update federal nursing home policy to improve quality care and oversight. And there is a bipartisan companion bill over in the Senate. Again, we know that this is a very important issue for senior citizens. That is one of the reasons why I co-sponsored H.R. 6783, which is a Autism Family Caregivers Act. And then I also co-sponsored the Alzheimer's Caregiver Support Act, too, because we know that a lot of people that have dementia-related illnesses will also end up in nursing homes. And so we need to make sure that we take the question that you asked very seriously. I think Texas has more nursing homes than any state in the entire country, even more than California. And we need to make sure that we get this right so our senior citizens can get the help that they need in a humane way in our country's nursing homes. Thank you very much for your question.
Yeah, appreciate you, Pearl. Thank you so much. And folks, we are just about out of time. We're going to start wrapping up here. I'll give you the results here of our last poll. We asked you, how concerned are you about the price of prescription drugs? 67% of you said extremely concerned. 14% said moderately concerned, and 19% were less concerned than that. So thanks again for voting in those polls. We really do appreciate that feedback. We also, I wanted to remind you of how you can get assistance if you haven't already. For a reminder, Milton in north side of Fort Worth and Corrine in Fort Worth, the Congressman's office is going to follow up with both of you, so thanks again for reaching out today for help. For anybody else who needs assistance from the Congressman's office, you can go to, you can call the Fort Worth office at 920-9086. You can also learn more about the Congressman's work at veasey.house.gov. And with that, Congressman, I'll turn it over to you to offer any closing thoughts before we wrap up here.
No, absolutely. Thank you very much. And I want to, again, just thank our moderators. I thank everyone that took the time to be a part of this very important town hall meeting that was aimed at our senior citizens. I hope that people got some answers and some information that they needed. Again, I want to ask everybody to please be sure to call either the Dallas office at 214-741-1387 or the Fort Worth office at 817-920-9086. We want to hear from you on prescription drugs, on Social Security, on Medicare and Medicaid, on nursing homes, on jobs, on how we can get help for grandparents raising grandkids, what resources that grandparents need for their grandkids, just all of those different topics. We want to hear from the 33rd Congressional District senior citizens on these topics and any other ones that you have. We know, again, that the issue around gun safety is also very important, and we want to hear from senior citizens on this very pressing issue as well. And if you have personal casework that's needed, please call our office again at 817-920-9086 or 214-741-1387. The caseworkers are here to help you work your way through this myriad of very pressing issues as it relates to everything that's happening in the federal government. Again, thank you. It was great to spend part of my morning with you, and we will be reaching out to you again to get your opinion on these topics and many others that are affecting our nation. God bless Texas. God bless America. Thank you very much. Bye-bye.